We sat on this couch the night we lost Liam, and the resource officer from the school said, "How do you want us to communicate this to the school?" And we said, "You tell them what happened.
Be honest.
Be honest. These kids need to know that their friend chose to end their life."
I never thought of asking Liam about his mental health. It was never even a thought that crossed my mind. There's not always signs. He was always positive, always walked into the room with a smile, and yet he still decided to take his own life.
We lose 50,000 people a year in the US to suicide. That's staggering.
I think the more we talk about it, the more we're going to realize how much of an issue, how much of an epidemic it really is in our society.
In my professional life, I get the opportunity every once in a while to see the people who don't think they can be seen, don't think they can be heard. And unfortunately, I run into them when they ran out of other options.
There's a negative stigma associated with mental health. It's just not something people want to talk about. You don't hesitate to tell somebody about a cancer diagnosis or some other physical ailment that you have. Mental health and behavioral health aren't things that are discussed.
So for us, it's about taking away some of that stigma, both with making mental health more accessible and also sometimes bringing it to the patients where they live. 96% of the counties in North Dakota and somewhere right around 86% of the counties in South Dakota don't have appropriate mental health care. And so with that kind of a healthcare desert for mental health in particular, what we need to do is make sure that if you need to see somebody, we have enough people trained that whether you connect with me digitally or in person, I can get somebody in front of you that can help you through. We should be able to deliver mental health care that day if that's what a patient needs. Right now, 1 out of every 5 of our behavioral health visits are done online. So you can do it from your house, you can do it from your office. And so one of the things that we have done is involved additional therapists, but we still have a team member that's just there dedicated to mental health. And they can be, if they need to, in several clinics at once.
Our goal in making our donation is to help provide access to those people that need it, when they need it, where they need it. My mom struggled with depression for years. Having access to good quality care made a huge difference in her life. Seeing what kind of difference that can make, it really inspires us. You are not alone. I think it's easy to feel alone, but you're not.
I think the next place to go is, how do we get into the schools? How do we get into those places where kids are?
Both my mom and I serve, within various capacities within Sanford Health. So we've, been given more of a first-hand look.
I think sometimes kids don't know where to go. They need an outlet for where they can be heard. Together with Sanford, we can hopefully reach some of these kids.
First International Bank and Trust is helping launch the Teen Be Heard program.
We're going to schools and really encourage people to seek counseling, seek help when they need it.
Part of launching the Teen Be Heard program is not only giving tools and resources for the students, but more importantly, probably giving tools and resources to the parents so they can help address these concerns.
We need these programs in place to help people, help families, help children. We may not always know what's going on in people's lives. There have been many instances where people said, I didn't see the warning signs. I didn't know. We can hopefully get to them through this Be Heard program. I think it's very important right now.
Liam being who Liam was, I think it was shocking for a lot of people because he didn't look like what you think the face of mental illness is or the face of suicide is. So we talk a lot about that day. We talk about the normalcy of that day. Had a normal school day from everything we could tell.
Yep.
We hung out, he came home, he played with his sister.
He helped me make dinner and set the table, kind of danced and joked around as you do as a family, moving throughout the kitchen. I'll never forget it. There was nothing abnormal about any of it.
No, it's imprinted on our brains because
Forever.
Of what happened, but it would have been any other day,
Any
right?
normal day.
And we left, and as we were leaving, Elizabeth poked her head back in and said, "Love you guys," and
Yeah, I love you guys.
which isn't abnormal. And Liam was sitting there making ice cream for him and his sister. Greatest big brother in the world.
We'll only be gone an hour.
Yeah, we left the house, we came back an hour later, and everything was different. And we'll never know why.
It was shocking. It was hard to believe. Instantly dove into deep depression, sadness, anger, questioning why, what happened. Today, more positive outlook. It helped me realize how important suicide and mental health awareness truly is.
Watching Liam's friends continue to grow and do amazing things, it's beautiful and I love it.
Liam's friendship and death has defined a portion of their lives, but I think there's a lot of positive to that too. They've found their voice.
It's helped me realize how important it is to talk about mental health and suicide awareness, and help me reach out to those who I've seen may be struggling and ask just if they need help or if they need a friend.
You know, here we are 2 years later and his friends are doing college visits and going to prom, and it tears your heart out.
It does.
One moment it can change all kinds of lives. And if he'd gotten through that moment, there is so much amazing on the other side.
You get through those tough points and there's light and beauty on the other side.
I'd say my greatest hope is for us just to start having these conversations and truly say that we can end suicide. Now you look back at it, it's like if he had those resources, would he have made a different decision? We channel Liam a lot, you know, that energy, which allows us to speak.
I think talking about Liam's story helps me, one, because I get to tell people how amazing he was, but also knowing that talking about him is going to save somebody else. It's an honor. That's something that I will do every day the rest of my life, is tell his story.
We're all changed because we knew Liam and loved Liam. And then the way he died, you know, people say we don't want that to define him, but in a positive way, it can define him.
And through his death, he will save lives. He already has, and he will continue to.
Yeah, that's why we share. Because we can't lose more kids. He will change the world, even though he's not with us anymore.
Truth, light, and hope. I see that as Liam's legacy.